Samaritan Cardiology is truly a fantastic place. We're able to offer a broad grouping of care options for patients, from preventing coronary disease or reducing the risk of its development all the way through treatment. And we're able to do that in each of the communities that Samaritan is a part of. Service lines that we have start with our primary prevention program, working to reduce the risk of developing coronary disease in the first place. We have a large grouping of general cardiologists who are focused on maintaining the care of individuals who have developed coronary disease. We have an excellent group of interventionalists and cardiac surgeons who are tasked with opening up blood vessels and fixing problem areas. And then from there can branch into our electrophysiology colleagues who manage patients who have funny heart rhythm issues or need for specific electrical management. And then we partner closely with behavioral health. Our group has tremendously grown over the last several years. That not only includes our excellent attending staff, it's also our fantastic advanced practitioner staff, as well as the development of a cardiology fellowship. So we are one of only 2 programs within the state of Oregon that actually trains the future cardiologists, several of whom have joined our faculty. We take care of almost everyone with almost anything related to the heart. Our cardiac surgeons are Stanford faculty embedded locally. We also have a close partnership with St. Vincent's or OHSU in Portland. When a patient is identified, usually by their primary care provider, with a cardiac issue, then the primary care provider will initiate therapies, may contact the cardiologist to help get things going, will then be referred to a cardiologist who will evaluate them fully, help understand what the issues are. And then if procedures are necessary, those will typically happen within Corvallis, which is where the bulk of our procedures occur. If that's not necessary and different types of testing that can be performed in the local communities is felt to be the best way forward, that's usually done within the site closest to somebody's home. Beyond cardiology, we do cardiovascular testing. So all sites do echocardiograms, EKGs, other tests that are required for a patient to really be understood by their cardiology team. Once a patient's issue has been fully addressed, then they may be going back to their primary care provider for ongoing management, remaining a patient of cardiology's forever. And if ever needed, then it's a very easy process for the primary care doc to get a hold of us and say, this individual needs some help, can you take care of it? And we're right there. While we are a larger program, we're still able to maintain that small town sort of feel. If you call our office, you get one of our staff members. They probably know you if you've been with us for a while. We're able to work very closely with the community doctors as well as the hospital doctors because we know them. I communicate on my cell phone with them all the time. So it really allows for very integrated, very closely discussed patient care.